It is estimated that more than a third of the U.S. population struggles with insomnia, and for many, that means turning to medication. A recent study in the Annals of Internal Medicine recommending another approach for getting a good night's sleep, cognitive behavioral therapy. Dr. Mark Rosenblum from the Minnesota Sleep Institute is here to explain this no-drug approach. Welcome. Good to have you here today.
Thank you for having me.
What is the study about? What did it tell you, and what did you learn that you didn't know before?
Well, this study has been the end result of a number of studies that have been demonstrating that cognitive behavioral therapy for insomnia is an effective way to resolve insomnia. And what has happened here is we finally reached the point that the results from the insomnia treatments show that this is as effective as the medications without any of the risk for side effects or dependency or anything else people hear about.
Which is increasingly the problem, whether it's over-the-counter or prescribed medication. That's the domino that folks are finding after taking them for a period of time. What is this cognitive behavioral therapy? What is this, and how does it look?
Well, many people are familiar with the idea of first trying to change something called sleep hygiene or sleep habits. And this is really where this all began. And since that time, we've developed other techniques which essentially are like trying to retrain someone to sleep. The comparison I get is anybody who's ever had to train a child to sleep during the night, we can use a lot of the same ideas and get someone's insomnia under control now.
Well, give me an idea of how that looks. You're talking about a darkened room, the same time that you go down each night, those kinds of things, the temperature of the room. What are the aspects of that you try to show people?
Well, so where we've now gotten to the point is when someone is having a hard time sleeping, oftentimes they've heard this idea about getting out of bed. Well, we now take this even a step farther where we have them do a fairly specific routine and wait to go back to bed until they're generally sleepy. And as simple as it sounds, it's actually a little more complex to do, but when you can do it and do it right, we can resolve most insomnias.
So give me an idea. So let's say I wake up in the middle of the night and it's more than just having to go to the bathroom quickly. How do you go back to sleep quickly?
Well, it's actually the opposite. We focus on not trying to get back to sleep quickly. We try to actually remove the pressure and tell people to take your time. There's no rush, because for most people who've had chronic insomnia, they overestimate the consequence if they don't get sleep on a given night.
Because you have anxiety. You're saying, oh my
Exactly.
gosh, I'm wide awake. And then that's when all of that takes. Oh, so it's interesting. How long does it take for this approach to work for people that you see?
Well, when people come into the clinic, I let them know, expect about 6 sessions. But to be honest, we sometimes can see results as early as 2 or 3 sessions, and sometimes as many as 8 or 9.
Are your habits very important, and do they inform sleep as well? We're still talking about nutrition and exercise, not a lot of alcohol, avoiding tobacco. Are all those things still the constant here?
They still are, but we look at them just a little bit differently now. In the past, we were hoping to be able to resolve insomnia with them. And we have found, while important, it's not necessarily enough. So maintaining these good sleep habits are important for preventing getting insomnia. So if you're someone who sleeps well, by following all these instructions, you're really decreasing the chance you'll develop insomnia.
Well, this is all a fascinating area. I'm sorry we have to leave it here for today. Vera, thank you for being here and starting the conversation with us. We're going to have more information for you on this topic at kare11.com with some valuable links. You can find them under the Shows tab in the News at 4.